Hi, evening. My name is Jeff McKay, and I am doing a video presentation on toxic shock syndrome and how it relates to our class in microbiology. It is a critical health concern, and as discussed in chapter 20 of our textbook, toxic shock is a condition that can be life-threatening, and it's crucial that we understand its significance. As a male, I don't really know as in-depth as those who have menstrual cycles, but from what I can gather and learn, it is significant, and it's got not very many causes. It is preventable, and the treatment for it, there is one. Toxic shock syndrome is rare, but severe medical condition caused by the release of toxic substances into the bloodstream. It can affect both men and women, but commonly associated with menstruating women using high absorbency tampons. However, toxic shock can present in all population. It's not as common. Moving on, the toxic shock is primarily caused by Staph aureus, specifically the strains that produce toxic shock is TSST1. The bacterium can thrive on various surfaces and even colonize in the human nose and throat, just like Staph does. It can enter the body through a mucous membrane, anywhere, open wounds, or even a minor skin injury. They produce toxins that can enter the bloodstream, triggering an immune response and leading to toxic shock. Toxic shock can range from a high fever and a rash to low blood pressure and shock, organ failure. If you suspect that you have toxic shock, you have to seek immediate medical attention. The treatment typically involves being hospitalized, antibiotics to combat the infection, and whatever supportive care that you would need to, get out of shock so your organs don't die. IV therapy, fluid replacement, electrolyte therapy, other than, killing the bug inside of your bloodstream. That's the most important thing. In conclusion, the toxic shock syndrome is rare, but it happens. When I was working on the ambulance years ago, I remember I would get a couple of these calls. It's the same thing over and over again. It's just people who are unable to get feminine hygiene supplies. And I hate to bring politics into it, but women are vastly underserved, and toxic shock does not have to happen at all if you correctly take care of yourself and if you have the resources that are necessary. I will be attaching a presentation with examples and pictures like is requested in the assignment. And I thank you for watching all 3 minutes and 30 seconds of me talking about toxic shock syndrome. I hope you have a good night. Thank you.